Hi everyone, I'd like to welcome you to the Refuat Hanefesh live interview that we have tonight. Refuat Hanefesh is a recognized charity dedicated to decreasing the stigma surrounding mental illness through conversation and education, while providing a safe place for those affected to seek support and advice. And we appreciate you being here with us. And tonight's guest is Dena Croog Cohen. So I'm going to tell you a little bit about her. And Dena has founded an organization called Refuat, which is a nonprofit organization that was formed as a means to provide the Jewish community with education about and support for those affected by depression and bipolar disorder. This includes people who themselves have these mood disorders, as well as their loved ones. According to the Refuat's mission, we will achieve this mission via educational outreach and through continued management of our peer-led support groups for people with mood disorders and for their loved ones. Their ultimate goal is to, by providing such education and support, assist these individuals on an ongoing basis towards better mental health management of these disorders, as well as educate the general Jewish population and decrease disorder-related stigma that may impede proper care and management, making us very closely aligned in terms of some of the things we're trying to accomplish. I will tell you a little bit about Dena in the formal sense, and we will have the next hour or so to get a better sense of who she is and some of the amazing work she's done in our community. So Dena is a writer and editor in northern New Jersey. She has worked in the medical, psychiatry, and mental health fields, as well as in the book publishing industry. She was an assistant editor, as well as a freelance writer and book reviewer for Publishers Weekly. Her career shifted into medical publishing, where she was senior editor of Primary Psychiatry, a psychiatry journal aimed at primary care physicians and psychiatrists, after which she freelanced as a copy editor for numerous healthcare advertising and medical education companies. In 2012, Dena started an online forum for Jews with mood disorders, the first step in what culminated in founding Refuat. Dena is a trained peer support group facilitator at the Mood Disorder Support Group of New York, after which the Refuat Mood Disorder Support Groups are modeled, and is also on the advisory board of Elijah's Journey, an organization dedicated to increasing suicide awareness and prevention in the Jewish community. She writes an op-ed column for the Jewish Standard under her maiden name Croog. Her first op-ed column in February 2014, titled I Have Bipolar Disorder, which addressed the need to speak openly about mood disorders in the Jewish community, won an Excellence in Journalism Award issued by the New Jersey Society of Professional Journalists. Since then, Refuat has been featured in articles and columns in both the Jewish Link of New Jersey and the Jewish Standard. Dena continues with her own writing, which she hopes to see published before the death of the printed word. More information about Dena's editorial and mental health advocacy achievements can be found at denacroog.com. So it's our pleasure at Refuat Hanefesh tonight to welcome Dena to tonight's talk. We have a bunch of questions for Dena, and we look forward to any questions that you, our dear audience, might submit to us. So without further ado, let's get started. Dena, thank you for joining us. How are you this evening?
I'm doing well. Thank you for having me.
Great. So the first thing I'm trying to get a sense of, and I think probably a lot of people out there as well are wondering, we talked about support groups. This is listed prominently on your website as something that you do. And my understanding is this is what you're passionate about. Can you tell us what is a support group, and then more specifically, what is a support group for a mood disorder?
Sure. Well, first of all, it's a peer support group. So it's a group of people who have gone through similar experiences. And these groups are peer-led. So even the people who are facilitating are in the same boat, so to speak. And, there are a lot of different types of support groups, and I guess they go, they're similar in that you have people helping each other and understanding one another on a one-to-one or personal basis. And it's helpful to have kind of a community environment where people kind of feel at home even with strangers, because if you understand each other, that's all that really matters. The Refuat support groups are specifically for, well, there are two support groups actually. There's one for people with mood disorders. The people with mood disorders, that includes people with depression and people with bipolar disorder. And, there are different types and categories of each. A lot of participants have comorbid disorders, oftentimes anxiety, and some others. But, the main joining factor is they have mood disorder. The second group is for family members and loved ones of people with a mood disorder. They're completely separate groups, separate facilitators, and those are definitely important as well. People who have family members who have a mood disorder, they need support, and they need guidance sometimes, practical guidance, emotional guidance, and how to support their family member, but also how to take care of themselves in the process, because it can be difficult to live with someone who has a mood disorder. And the group for people who, like I said, the people who have a mood disorder, it's helpful to learn from one another, to feel less alone, and also practical tips about, what to do for self-care and what type of therapy there is, and, things like that.
Thank you so much. So if we were to talk about the different components that make up a mood disorder, without necessarily giving a formal criteria, when we use the term mood disorder, what are we talking about?
Well, I would say fluctuation of mood. It depends on which one you're talking about. If it's, depression alone, which is not, it's not like it, as opposed to, depression with mania, there's still a fluctuation of mood where, there's a depressed, not just emotionally depressed, but also physically depressed as well. People can't get out of bed sometimes. It's hard to do things. So that, it's a change, it affects the emotions, but I think it also, it affects the thoughts too. People say mood disorders, but I think that there's a lot of thought disorder to it as well. Not especially with bipolar. It's just different. With depression, your thoughts are kind of tricking you. That's how I would say it. I always look at it as the depression or the mania or whatever it is kind of pretending to be you. I don't know if that makes sense, but where you think that it's you who's feeling that way and thinking that way, but it's really the disease. With bipolar as well, there's, that fluctuation of depression and mania, which is heightened energy. And I think sometimes, and, I guess you know a lot about this too, people view mania as, all flighty and, happy-go-lucky, reaching the stars, all that. But at least what I've learned and I've experienced is that mania is really heightened energy, which can be positive or negative. So sometimes it takes the form of agitation. I think that's part of why a lot of mood disorders, bipolar disorders, get misdiagnosed. Not all the time, but a lot of times it's mistaken for anxiety when it can be kind of more than anxiety or different than anxiety.
Okay, thank you so much. So if I'm understanding you correctly, so a mood disorder, while it does have other symptoms that might include issues with thought and thinking, the predominant feature is a mood and fluctuation in mood. And so we're going from either a baseline mood to a really depressed, sad mood, to maybe going from a sad mood all the way to a manic episode, maybe with a baseline in between. But a shift in mood in the extremes is probably the most predominant feature, along with other symptoms.
Can you, I'm sorry, I can't hear you so well. Is that because of?
Sure. So we're saying that the most predominant feature is really a shift in mood, even while there might be other symptoms that come with that as well.
Sure.
Okay. So I know that in our conversations previously, you've spoken about the importance of a threefold approach to getting better. And you talked about the importance of therapy, medication, and self-care. Can you tell us a little bit about each of those categories?
Sure. Therapy is very important for someone who has a mood disorder. And I think that there are different types of therapy, and I mean, there are different types of therapy, and I think different types help at different moments of someone's life. When you're first diagnosed, sometimes it's like you don't know which way is up. I think that talk therapy can be very important. And, you know, there's, at other times there's cognitive behavioral therapy that helps, I think, later on. And in terms of your behavior, and other types of therapy, I think that therapy is essential in terms of trying to figure out what you've gone through and also trying to figure out how you can manage, you know, in the world, whether that's internally or externally with, you know, something basic as getting through your day, keeping a job, social situations, and then how to, you know, then in your mind, how to figure out, I guess, how to work with your emotions and thoughts. And I think that it works hand in hand with medication, because medication is what's going to hopefully stabilize you. And I think that therapy, it doesn't work as well if you are not, well, either not on medication or not stabilized. I think it's kind of, it makes sense that the more level your mood is and the more you're thinking straight, the more productive you'll be able to do in therapy. So those two things are really important. There's also self-care, which that's practical things like getting enough sleep, exercise, eating right, and all these things. They're essential on a practical basis, and just in terms of managing the mood, especially sleep is a very important thing. Having enough sleep and sleep cycles, it really affects the mood. And I think also part of self-care is it's education. You know, educating yourself about mood disorders, about, you know, just reading up on them. And because I think that, you know, you're doing all these other things, therapy and medication, and trying to take care of yourself physically. But in order to, you know, even increase that, you know, how productive you can be and how well you can manage your disorder, knowing what's happening inside by, you know, educating yourself as much as possible, that really helps. And then, you know, then there's the peer support, which I think all of it together is really important.
Thank you. So I just wanted to comment briefly on each of those pieces. I think the self-care and therapy are very tied into each other, in that for many people, especially if they're probably in the more depressed state, doing those self-care activities can be very hard. They lack the motivation or the ability to maybe find these resources to them. And I think that a therapist, and this is something I do very often for my patients, can do a lot. Recognizing the value of things like exercise, good sleep, social support, whether that's in a formal peer support group like you run or elsewhere. I will spend significant time with a patient that seems less able to do so, getting them to do these things. So finding the resources for them, finding the language for them to reach out to their friends, even role-playing what that conversation might look like, helping them find a gym or developing some sort of system of accountability that they're going to go and do that exercise. So that's something to me that I see as a very important role. Again, knowing how important these things are, And recognizing that patients, depending on what state they're in, might struggle to do that, I will spend significant time trying to make that happen. I also wanted to add in terms of medication. Medication is obviously, or maybe not so obvious, it's a tricky balance. There's still a lot of art to the science of psychiatry, and finding the right medication is a big challenge, especially, and maybe we'll talk more about this later, if the right diagnosis has still not quite come along yet. But even with the right diagnosis, medication is still a challenge. I know that I work at a residential treatment center full-time, and we utilize something called GeneSight. And I'm not here promoting any particular brand of genetic testing, but the purpose of such a test lets the psychiatrist know which medications likely don't work that well for certain patients. And I've had parents and families tell me that they've spent years trying to get the right medication, and nothing seems to have worked. And once this genetic testing is thrown in, there seems to be a better chance of getting this right. And again, I'm not promoting this particular form of testing. Not every psychiatrist yet buys into this. It's still a fairly new piece of psychiatry. But getting the right medication can be very tricky. And again, that's where I think part of the role of therapy is, even while we're waiting for the patient to get stabilized, the patient still needs more support than sometimes they're getting in a 15-minute medication management session, to take the medication, to sit there and take it even with the side effects, to report the side effects, and to really be consistent with all of that. So I think that's an important piece. The other added piece related to medication and bipolar in general, and this speaks more to my clinical specialty, which is working with women in pregnancy. People with bipolar disorder are at a significantly increased risk for something called postpartum psychosis. So there's postpartum depression, which is when there's a depressive episode that develops relatively shortly after giving birth. Postpartum psychosis is when the woman develops a psychosis, so a psychotic episode. This happens fairly shortly after giving birth, anywhere from 2 to 3 days to 2 weeks after giving birth. And while it's incredibly rare in the general population, somebody with bipolar disorder has a vastly increased risk of developing a postpartum psychosis. And you mentioned sleep before. Sleep is actually one of the single best things that can be done to reduce the risk of postpartum psychosis. And that's why it's very important to be monitored very closely, because many people will respond and say it's fairly typical that this woman's not sleeping. She just gave birth. She's nursing around the clock. And if you're aware that there's such a history and you're cognizant of the signs that might be starting to show, the single best thing we can do is get this woman to sleep. Whether it means stopping nursing, having somebody else take over care, getting her to sleep is perhaps the most important thing. But many people sometimes ask, given that I have a history of bipolar disorder, can I safely get pregnant? Can I safely breastfeed? And unfortunately for many women, they do not get a clear answer to that, given that many OBGYNs, while they might be comfortable with the more basic antidepressants, anti-anxieties, might not be as comfortable with medications such as lithium, which is a more serious medication and more common for bipolar when somebody's pregnant or breastfeeding. So many of them will respond and say that the woman should go to a psychiatrist for this. And then many psychiatrists will then say, well, if you're pregnant and breastfeeding, you should speak to your OBGYN. Yeah. And then you have some practitioners, whether psychiatrists or OBGYNs, that take the liberty to tell the patient, maybe you should not bother getting pregnant. And so while we would almost never say that to somebody with a medical condition like diabetes, we'll just manage it all the way through a pregnancy, people seem to think it's okay to tell a woman with something like bipolar that you should forget about getting pregnant. And so I just want to point out here that there is a subfield of psychiatry called reproductive psychiatry. It's a group of psychiatrists who have done additional training in women's mental health, ranging through different mood disorders, menopause, a range of different issues that come up. And through some small case studies, a lot of close collaboration internationally, so there's access to a lot of data. These reproductive psychiatrists have really opened up the opportunities for women with a serious mood disorder to be able to plan a pregnancy safely and get through such a pregnancy safely. And they can even do so where there's a history of postpartum psychosis. So certainly for those people out there with bipolar disorder that are considering getting pregnant or are pregnant and want to know more about this, if you don't feel like you're getting the right answers from your psychiatrist and OBGYN, try to see if you can find a reproductive psychiatrist in your area, because that's definitely something that exists, and it's an important resource for some people. So moving along, so I was wondering if you could focus a little bit more on peer support groups and what happens in them. Why are they important? How might they look different than a professional therapy group?
Well, first of all, they're different from a therapy group because there isn't that same hierarchy. I guess you'd say there's no therapist. Like I said, everyone is a peer. The facilitators who run the groups are, they receive training, but they don't necessarily have a mental health degree. They might, but the joining factor is that they're a peer. What happens in the group is I actually have never been in a group therapy session, so I don't know if it goes like similar or not. But everyone gets a chance to, a turn to speak if they'd like to, and talk about how they're doing in relation to mental health. And a lot of people actually, a lot of the regulars kind of, they know what's going on with other people, and there's a lot of continuing of conversations and issues that they've spoken about at other times. And everyone's speaking from their own experience, what they went through and what they're going through and what it makes them think or feel. There are other participants are allowed to chime in, respectfully and within limits, to talk about what someone else said, how that resonates with them, how they can relate, what worked for them in that situation. And we'd go around the group, and this one I'm talking about is for the mood disorder group. We'll go around the circle. Oftentimes, as of late, we've been getting maybe 10 to 15 people per group. And everyone have a chance to speak, depending, we meet for an hour and a half. So it really depends on how many people, and also some people need to kind of talk a little more than others. Especially, if someone's kind of going through some type of crisis or a very serious situation that they're really trying to handle and having trouble with.
Thank you so much. Moving on to the next question. Can you tell me what you gained from peer support groups?
I found a place where I felt understood. When you have any illness or disorder and you're just learning about it, or even if you're not just learning about it and you think that you're the only one, or you don't find anyone who you can speak with about it, it's hard to get through. So what I found, especially when I first started going, I went to MDSG, which is the Mood Disorder Support Group of New York, in Manhattan. It's a great organization, and Refuat Hanefesh is modeled after it. I found a place where I felt more normal, so to speak. I felt like I could belong. I felt like people understood me. And I also received practical advice and tips of, strategies for how to get out of bed if you're not feeling up to it, and, things that can help with your mood. And, what was interesting about MDSG is you had people coming from all 5 boroughs and New Jersey, and people of all walks of life. And you can get in that room, and even, I would say for me, even before you start talking, there's such a connection in the room that in itself is powerful. And I think that helps people to feel they're able to open themselves up more and feel comfortable to talk about their own experiences and to share with other people. People come in to support one another, and people come in to receive support. And I think it's a give and take.
Thank you so much. Can you tell me more about what makes your groups Jewish friendly?
Well, it's Jewish friendly in that I think any demographic is going to have a certain, there's different culture and traditions. It's Jewish friendly because it's catered towards Jewish people. There are people from, I would say, across the spectrum of observance, but there's still that understanding of, where we came from as Jewish people. And, even someone who's not observant will understand, some tradition you're talking about. And it's helpful because you can kind of talk in a shorthand. You don't have to start getting into details of, what you mean by the rituals of Passover, things like that.
Got it. And can you tell me what these groups do, in your opinion, to reduce stigma around mental health?
I think just the fact that, first of all, just the fact that they exist and people hear about them, I think that in itself, I don't know if you found this with your organization, but just having that presence and being out there, I think helps to start, chipping away at stigma. I also think that participants who come to the groups and they, at first a lot of people are, very worried about anyone knowing anything about them, understandably. And I think over time people gain perspective, and they also might become more open with other people about their illnesses and more willing to talk about them. And that in itself helps to reduce stigma when more people are able to discuss what they're going through.
Yeah, so these groups are sounding amazing. I'm wondering if you could share if there are any limitations to a peer support group.
I would say the limitations are, well, what we were talking about before. It's not therapy. It's not medication. And I don't really think that in that way it's a limitation, because they all work hand in hand. I guess, yeah. I mean, I think that what happens in the groups is you discuss therapy and you discuss medication and you discuss self-care. So that's helpful, and it plays its own role.
Okay, thank you. I would just add one comment as you mentioned the idea of discussing medication. In various parts of my work, I've been part of a lot of non-professional peer support sources. Typically, I'd say they're groups on Facebook for a range of different issues. One of the concerns I've had is the way sometimes medication is discussed. I think that it's definitely a useful thing for people sometimes to hear about the way different medications work for different people, or ways people deal with side effects and stay motivated to take medication and so on. What concerns me sometimes is when I see people offering advice that extends more into the domain of the prescriber.
Yes.
So advice on how to change the way you're taking your medication, or not taking it, and so on. What I would recommend is that people utilize these support groups as a means to gain all sorts of information. But then if they want to do anything different with that, they should bring that information to their prescriber. It's okay to come to your psychiatrist and say, I heard about this medication. Do you think it could help? Or so-and-so said that if I switch my medication from morning to nighttime, it might help with my fatigue by day. Right. So I think those are excellent things one can go back to the prescriber, but it sometimes worries me when people try to do based on what they're seeing. Right. There's a lot of different factors that go into why somebody might get certain medications at certain times, and it's really important to just bring that information back.
I absolutely agree. In our support groups, when people bring up a medication, I'm very strong about saying, different medications work for different people, different dosages, different combinations at different times. And it is useful to know what possible side effects someone might have, but another person might not have anything like that. And you're right, it's very important to kind of leave that to the prescriber.
Thank you. And now, given that we're talking about the Jewish community, and I think this might be true for some other traditional communities as well, Very often people will say that they want a therapist that's of their gender. I'm wondering what your thoughts are on support groups as to whether a male patient should try to go to a support group that's men only and a female patient should go to a support group that's female only. What your thoughts are about that in general and maybe what you've done at your organization.
Right, well, first of all, I just, in terms of patient, like we call people participants. I know you see them as patients, but I think that's a very important distinction because you're in a group where people are kind of trying to understand one another, and it's a different setting than when you're in a clinical setting. But in terms of male and female, I think a lot of people, they have their own opinion. I find it, you learn from everyone. We've had people who come in and they think that they might not necessarily be able to associate well with someone of a different gender, and then they realize, no, that's not true. On the other hand, there are some people. I had a couple of women who were from a more religious community, and they felt like they can be more comfortable sharing with other women. So one of our participants, she actually started a group for women in Brooklyn. She trained with me a little bit. She got connected with another organization, and she made it for women who deal with depression and bipolar disorder. And then I know you're familiar with Chazkenu, which is an organization for women with mental illness, and I think that's important too. It's important for everyone to kind of feel comfortable. I just think that in our groups, I think for the most part, people do feel comfortable talking with, male, female. I don't think it really matters.
Okay. I appreciate you sharing that. I think it might also be possible that aside from the, people very often, I think, don't anticipate everywhere that these groups could potentially go. And some people might assume that for, bipolar disorder, if we're going to talk about how to manage, you talked about the importance of sleep and exercise. If we're talking about the best ways to do that and medication, maybe gender doesn't matter. But the premise of a good group, and I think this is true for a professional-run group and a peer support group, is that they could really go anywhere. Even with a careful agenda, people's lives are complex. And also, you mentioned earlier the idea of dual diagnosis or co-occurring disorders. People bring a lot of stuff with them. And so people might come into a group with a mental health diagnosis, but they might also have a history of sexual assault or child abuse or substance abuse, marital issues, a range of different things that as the conversation starts to go there and the intersection of those things and the mental health issue, it might be more concerning to them. So I think that, again, given some people's specific backgrounds, they may feel more comfortable with the same gender. But in concept, I think you're right, that they don't necessarily have to be different. I just want to remind everybody that for those of you who are listening, you can feel free to send in questions or comments anonymously to info@refuathanefesh.org. So continuing along, we talked about gender. I'm wondering if you can say more about age. Does age matter?
I think that having different ages can be more positive than negative. The bulk of participants range from, I guess I'd say mid-20s to mid-60s. I know that's a big range, but we've had people as young as 16. We've had people as old as 90. And I think that people can learn from one another of different ages because you have one person who's been there and they have life experience to share. Or you have someone who's older can learn from someone who's younger too. I think that it's just nice to have more perspective. So I guess like gender, I think that there's no negative really, at least from what I've experienced.
Okay, thank you. Would you say your groups are confidential?
Absolutely. I mean, that's one of the founding principles and rules. Nothing that's said in the group is said out of the group, and even, no, you don't talk about who you saw in the group. I've bumped into people on the street who I know from the group, and I won't, if they want to say hi to me, great. But, I think it's told in the group, and it's spoken about where, what's in here stays here. If you're someone in the group, you don't want someone talking about you. So you're not, you won't talk about them. And that's something that we're very, we're very strict about. Of course you can't make someone do something out of the group, but I think people they have that sensitivity.
Yes, I just want to add some context to that. Tell me if you think this is true in the context of your groups. I think that's where you were going with your last point. The difference between the mental health professional and the participants in a group is that the mental health professional essentially guarantees confidentiality, meaning there's a professional obligation to do so. And if that's broken, then there's even legal recourse to be able to sue a professional for breaking confidentiality. It's the bedrock of the field of mental health, with the only exceptions being somebody's going to hurt themselves or hurt somebody else or known child abuse. When it comes to group participants, whether it's a professional-led therapy group or a support group, nobody can guarantee that. That's an expectation that is taken incredibly seriously. And for the most part, it's self-enforcing, meaning if you don't want your stuff shared, you're not likely to share other people's stuff. And the rule of thumb I give patients or participants in groups that I run is that if you want to share your own experience, you're welcome to do so. You can say, I learned X, Y, and Z about myself in group, or I got the following feedback about myself in group today. But don't share about anybody else. Would you say that's similar to the way you guys do it?
Yeah.
Okay. Yeah. Next question. Can you tell me more about who runs your groups?
So there are trained peer facilitators who, I received training from the Mood Disorder Support Group of New York, which I've mentioned before. And the other facilitators were trained by me, as well as one of the psychiatrists on our board of directors who specializes in mood disorders and substance abuse as well. So there's kind of a joint. There's no it's not, well, there is actually a manual, but facilitators kind of get a little training in terms of psychoeducation, as well as how to lead a group, different tips on how to, keep the group going along. And so we've had people who, again, it's a peer support group. So the facilitators are peers, not necessarily with mental health degrees, though we have had facilitators with mental health degrees, whether, an MSW or a psychiatrist, or we have had people, but they absolutely need to be a peer. So if it's for the family group, then, they have to have someone who, a family member, a loved one who they also can associate with the group about. And, likewise in the diagnosis group.
Thank you so much. Can you tell me a little bit more about your founding this wonderful organization, how you got there?
It's been a long time in the making, actually. I first had an idea to start some type of project in the Jewish community back in 2003. I kind of had some parlor meetings about it. It was kind of a reaction to the suicide of a friend. And this is after I had experienced depressive episodes, and I had finally understood that it was depression. And when this happened, when my friend, it made me see the illnesses outside of myself. At the time, I thought it was, depression. So what happened was I started getting people together in parlor meetings to try to make something happen, to have some type of educational program. And then, I got a little sidetracked because I had an episode that finally we determined I had bipolar disorder. And I kind of left the idea on the side, kind of had to figure other things out. So I always followed up on what was going on in the mental health field and if anything was going on in the Jewish world. And eventually I started kind of picking up the idea in 2012, 2013. I met with people, researched, if there are any programs going on in the Jewish world. And there wasn't anything like what I wanted to do, which was have peer support groups. This is after I had already gone to MDSG in the city, and I knew that it was helpful, and I wanted it to bring it to a community, where I grew up, because I know that it would have been really helpful for me back then. So I just spoke with a lot of people, did a lot of networking, and created a board of directors, got other people who wanted to be involved, and we created a nonprofit organization with the two ideas in mind: to have a support group or support groups, and to do some kind of educational programming or destigmatization, or just awareness, I guess you'd say, about mood disorders. So that was I guess in 2014, and that's when we received nonprofit status in 2014. I think it was January. I'm not sure. And then at the time, actually, it was kind of like, I don't know, it fell from the sky. I was asked if I wanted to write an op-ed column for the Jewish Standard, which is for northern New Jersey, Bergen County and the surrounding areas. So I said yes. And my first column that I wrote, I decided, like you mentioned, I wrote a column called I Have Bipolar Disorder. And it was really good timing for helping to launch the organization. I felt like, I have a platform here to reach a wide Jewish audience. And, it wasn't like it was a secret what I've gone through. I'm pretty open about the illness. But this was kind of like, all right, I'm reaching the public. If I'm going to really do this, I have to put my money where my mouth is. And, it's really interesting because when I guess you take that leap, I guess you'd say, when you throw yourself out there like that, so many people come out of the woodwork and, they appreciate what you say because they've gone through something themselves or they have a relative. And I think that just opening up that door really helped to start off Refuat Hanefesh.
Thank you. And I guess one thing that I think people might be wondering is, what gives you the courage to share your story so openly? Certainly, at Refuat Hanefesh, our mission is about reducing stigma, and we're looking for more people like you. So what do you think did it?
I actually wouldn't call it courage, and people have mentioned this to me. I think I'd call it frustration. I had my first major depressive episode in 10th grade, and I had no idea that's what it was. I thought, I'm a writer, and, I was, a brooding artist, teenager, a moody teenager, and searching for the philosophical, whatever, the meaning of life. And, I didn't have any help then, and I didn't even know I needed help. And then in college, I, finally had, I got the language the vocabulary to actually talk about what was going on with me. I finally met other people. And, then again, when I was misdiagnosed for 10 years and I, finally got the right diagnosis. And a lot of this was, I think a lot of people, they go through a struggle. And for me, I was just frustrated. I was like, why should someone have to go through this? Why isn't there anything out here like this? I think, obviously I think it's very helpful for other people. And I don't know, I just wanted to do something. I wanted to get something done. And I guess I was just like jumping in, and I had no idea if anyone was going to catch me. I might fall flat on my face, but I just I had enough.
Yeah. Are you personally familiar with any resources for people that are not living in the New York, New Jersey area? Like, where should they get started?
For Jewish related or in general?
Both.
Well, in terms of like support groups, there's there's the Depression and Bipolar Support Alliance, and they have on their website, like I guess support group locators for wherever you live. You can find something that's nearby. I think they also have online support groups there too, and NAMI, the National Alliance on Mental Illness. Is that right? They also have support groups throughout the country. In terms of Jewish, I mean, I haven't heard of anything like what Refuat is doing, and actually, we'd like to expand at some point in terms of where we have our groups. That would take a lot of work, but it'll be very fulfilling. I know, like I mentioned before, there's Chazkenu for Jewish women who have mental illness, where one of the main things they do is they have a speaker twice a week. Women can call in to hear what they're saying and to kind of like chime in what resonated with them, to also send in questions anonymously if they'd like. I know that's helpful. I think some people tried to start I don't know if you know about this. Some people tried to start a male group. I don't know if they got far with it. I mean, in the Jewish world, maybe I'm just not hearing about it, but I don't know of anything like this.
Okay. And so I guess people can get in touch with you if they're looking to start, I guess, other chapters.
For sure.
Okay. And I'll also put it out there that Refuat Hanefesh hosts a support room as well for those looking for support. Where maybe you're in an area that doesn't have that. Tell me more about the support group for families. We've spoken a lot about for the participants themselves with this mental health disorder. Tell me a little bit about the family one.
Okay, so the family one, like I said earlier, it's really important for people who have a family member with any illness, but with a mental illness, mood disorder, it's very important for the family members to themselves feel supported. I think that a lot goes on people's shoulders when they're trying to help care for someone, help someone manage their mood disorder. And what people find in the family group is they can speak with other people who kind of get it, who are going through what they're going through. And maybe in those groups, it's a little different. Well, first of all, they're smaller. And there's kind of like more of a like one-on-one conversational type meeting. And I think that sometimes there's just more practical information and advice that gets traded back and forth of what has helped someone in, what they went through with their loved one. And, people are actually coming to each other more for advice, even though that's really not the way it is in the diagnosis group. It's more like sharing your own experiences, how things, how it resonated with you. And there's the same thing there in the family group, but there's also more of like, hey, listen, this worked for me, this might work for you.
Thank you so much. I think that the family piece is absolutely critical. The main component of what I do at the Residential Treatment Center is family therapy. And so this is a residential treatment center here in South Florida, where people with a range of mental health or substance abuse or co-occurring disorders come for residential treatment, which for those who are not familiar with it is basically one step below a hospital. So people are either coming there from a hospital or coming there with the hopes of avoiding a hospital. So it's 24/7 care with, very intensive therapy, both individual and group, pretty much 8 to 9 hours a day. And our patients go every single night of the week to a meeting. So either it's a substance abuse meeting or it's a meeting similar to the ones you're running for depression. Or maybe some of them have other issues like a codependence issue, and they might go to meetings like that. So we take family therapy incredibly seriously, and it's a mixture of both family therapy and also a mixture of support. And for this purpose, I would define the difference as the therapy is focused on change. So what needs to change in the context of the family. And in terms of support is how can we support each other. And so we run a support call for families that takes place every week where I facilitate that call, but the purpose is really that the families can support each other. And I can, so to say, prescribe certain things, but families, as we say, in the trenches, who've been there, done that, can often provide a lot of support for each other. I think the family piece is often very critical. I distinctly remember when I was working at a major New York City hospital in their outpatient rehab department. So these were patients who, for the most part, had a brain injury, typically a traumatic brain injury. So they got into a fight, or they fell down a flight of subway stairs when they were intoxicated, or there was, some other assault or a car accident. So we did a tremendous amount of work with these patients. They were in a 3-day-a-week treatment program. This was after their hospitalization. They were living at home. They were still coming 3 days a week for treatment, therapy, and cognitive remediation, as well as social skills training, really just working from the ground up in terms of helping them with their deficits. And I remember meeting with one of my patient's partners at the end of the year, kind of like this hospital's version of a report card, letting the family know how their patient had done over the course of the year. And this person told me that you did so much for so-and-so. And I would see this, my partner coming home week after week, improving bit by bit. He's just in such a different place at this point, a year later. And I feel like I was in the same car accident that he was. But whereas he was in the front and he was rescued, I was left in the back, crushed. And that always stood with me because here we were a top hospital. For traumatic brain injury, we were one of the top 8 hospitals in the country in terms of effectively treating traumatic brain injury. And these patients were getting vast resources put into them. And yet their family support system, which is where they went home to every single night, and which is where they're going to continue to be well after we finish our work with them, was not getting anything more than a report card. And I know that that's not enough. We know that for a traumatic brain injury, the incidence of divorce is about 70%. It's sky high. And people with families who have a family member with mental health struggle in many, many ways. I've worked with couples, I've worked with parents, siblings, across a range of mental health and substance abuse issues. And it places an incredible challenge in families. And families cannot carry that indefinitely without appropriate support. And there's ultimately a limit to how much support professional family therapy can offer. What's critically important is families can connect with each other in a way to hear about anything from what do I tell other people when they ask questions, which is a very tricky question. As a family therapist, that can help them balance their values and understanding that this patient may be sick, but they still have a right to their own confidentiality. And it's different for each family. But there's nothing like a family being able to say, you know what, I tried this, it just works. You don't owe anybody any more information, just say this. So I am a huge believer in the family support process. And while there's a way to do it in family therapy, I think that perhaps more important for many families is a peer support component. So I was very excited to see that you guys are doing it.
There's actually another organization that started, I think, a year ago called Project OMETS. I'm not really sure where they're about now, but it kind of links parents of people with mental illness. I don't remember if it's any mental illness with each other. So kind of like giving yourselves a buddy. I don't know how you not a sponsor, but you are able to talk with one another, like you said, about what worked, what how you went through, what helps, advice, things like that.
Thank you so much for sharing that. My last question for you is, what advice would you have for somebody struggling with mental illness? Advice or message you want to share?
I simply would say it gets better. And it gets better. I think that's something that people really need to hear, that you might be stuck in a moment right now. You might not be able to see anything outside of it, but you know, you talk with someone, you hear from someone who's been there, who's been in the trenches with you, and who can understand where you are now, and they made it out. And there's hope, and that's what I would tell someone.
Well, thank you so much for joining us tonight. It was an honor to learn about the work you're doing.
Thank you.
And for those who would like to join us the next time, our next live conversation is August 12th, 2018 at 9 p.m. Title will be The Pain of an Okay Day with Hindi Finmana. Thank you so much for joining us. Have a wonderful evening.